Hello and welcome to my channel. My name is Dr. Daniel KOITATOI, creating awareness on many non-communicable and communicable medical conditions affecting us. We're going to look on esophageal cancer, and this is essentially an awareness video. Welcome. So esophageal cancer, like you see on this picture, it's a cancer that develops from the inner lining of the esophagus. Esophagus is also called the food pipe. So it makes the food pipe narrow and blocks it in the long run, if not attended to. So it usually develops in the inner lining of the esophagus, and it would grow upwards and across the wall, making the wall very narrow. I mean the lumen very narrow. So usually statistics tells us that there are about 18 people at any point in time per 100,000 diagnosed with esophageal cancer. And there are usually two types of esophageal cancer. There is one of the cancers that affects usually the upper 2/3 of the esophagus, called squamous cell carcinoma, and this classification is usually beneficial for the doctors managing the condition, and also to determine the likelihood of successful management. So the upper 2/3 usually is affected by squamous cell carcinoma, and usually the lower part is affected by adenocarcinoma. So those are the medical jargons to that. I've separated that because this is usually the commonest, and this is usually a bit less common. This part is usually less common, and sadly the less common part is usually more better in management and than the most common one that affects the upper 2/3. The risk factors are also different, as we shall see. So staging is usually done based on the size of the cancer, based on the size of the cancer, the size of the tumor. So from size 0, when the tumor is still very tiny and small in the lining of the the inner lining of the esophagus, the size grows all the way until it completely blocks the esophagus, both inside and outwards, and starts spreading to neighboring tissues. It will spread through blood and lymphatic vessels. So as blood travels around the body, it can move along with these cells, and you will find these cells in distant sites, like into your lungs, liver, and even to the brain. So usually when it's found in the first two stages, it's usually a bit better to manage, but in advanced stages complications sets in and it becomes a bit difficult to manage. So the risk factors are usually the things that we commonly do at home, and these are usually commonly seen amongst communities. People taking hot beverages, tea, like in the Maasai community, people take hot teas while exchanging pleasantries and sitting in groups. Taking alcohol, this has also been associated with increased risks of developing cancers. So people do a lot of this. Smoking and alcohol increases risks of developing esophageal cancer. So, and these ones usually cause the upper 2/3 of the esophagus cancer, the cancer called squamous cell carcinoma, and it is the commonest. I think that's why the cancer is seen to be the commonest, because this is more it's more common in the society. So another factor that causes this is reflux. Reflux is when you have food contents coming back upright, coming back to the esophagus, coming back upwards to the esophagus, and causing damage of the lining of the esophagus, just like what the tea will do. This usually tends to develop adenocarcinoma, which is the cancer that affects the lower 2/3 of the esophagus, and it's not usually very common. It's not usually very common like the squamous cell carcinoma. Another factor that has been associated with the development of esophageal cancer is absence of vegetables and fruits. This type of foods are very good and have been seen to reduce the occurrence of esophageal cancer. Probably this is why it's more common in the pastoralists, among the pastoralist communities, probably because these types of foods are not very available. Symptoms. This condition is a very silent disease that typically becomes symptomatic when it's advanced. So in the early stages, it's usually asymptomatic, and we should have a high index of suspicion. One should have a high index of suspicion, especially when you try to take something and you feel like there's an obstruction, you're not able to swallow it properly, or when you have recurrence of these heartburns, when you have any form of chest pain and you present to a doctor and you are advised to do an endoscopy, please do one. So because in early stages it's not usually symptomatic. In late stages it will present with obstruction. Obstruction is like you have the esophagus here and you have the trachea in front. So this is the trachea, but now the tumor grows from the esophagus like that. So usually at the first stages it will block something like ugali and solid foods. Then at the second stage it will block now semi-solids, so porridge cannot go through easily, and then finally it will block the liquids. So when you feel like you've tried to swallow ugali or chapati and then you feel a bit of food has stopped at some point, please see a doctor so that we can try to pick these things in the first stages. The other symptoms are usually not so common, but pain can be associated with swallowing, and then one will have weight loss, definitely will have weight loss from basically just having the cancer itself, and now from not being able to eat, and one loses appetite. So you get severe weight loss. Regurgitation. So when you cannot swallow food just comes back, and that's called regurgitation, because it is just there. It's not even vomiting, because you've not taken food all the way to the stomach. You just food just comes back from the esophagus before even you finish. Before even you place the cup or the spoon on the plate, back to the plate, you realize that food comes back. So that is called regurgitation. You can also vomit blood, because the tumor can have a corrosion or can develop a wound, and then it bleeds and you can see blood. How is it diagnosed? Usually what is done is what we call an endoscopy, or rather an OGD. An OGD is usually an imaging that looks into the esophagus, the stomach, and the duodenum. So normally you have a pipe that is attached to a camera, and then this pipe is passed through the mouth, through the esophagus. Of course you are sedated so that you are not feeling the discomfort, and then now the doctor is able to look through the pipe, the food pipe. So usually for someone now, like if you look at this image on the side, you can see these growths, these ones here. So this person has developed the cancer. So these are the things that are seen. It should be a clean one, like you see on the screen of this monitor here next to the patient. But now when you see these bumps here, now these are the growths. And then the doctor would want to pick a small pinch of it called a biopsy, so that now it's sent to another specialist called a pathologist to look into it and tell us what type of cells. Is it now the squamous cell carcinoma or the adenocarcinoma? That's why biopsies are usually very necessary to differentiate between the two, because they respond differently to treatment. Now, if this is seen, now the next thing is to do a CT scan, so that you're able to image now the neighboring tissues, the lungs, the trachea, the abdomen, or the neck, and the entire chest, so that you're able to look for any distant metastasis. Now, the complications that can arise are things like fistulas. A fistula is when you have a connection between two pipes. So you have the esophagus here again and the trachea here. So that growth can become so big and affect the wall, make it die, and then develop a small connection between this esophagus and the trachea. And usually that you get to know because whenever someone tries to swallow food, he is choked, because you got a fistula now, a connection. Of course, metastasis occurs now, the spread of the cancer from the source to the neighboring tissues. And then you get also hoarseness of voice, because again it directly affects the trachea around, or the nerves around the trachea that usually control the voice production. So look at how the esophagus and the trachea are very close to each other, just adjacent to each other, and therefore the pathology of the trachea can easily affect the pathology of the esophagus, or the problem in the esophagus, can easily affect directly the trachea. So usually what is done in management is surgery. Surgery will be very much curative if you present on time. If a patient presents on time, surgery is done to remove the cancerous part, if it has not spread elsewhere. And then now normally what is done is called translocation of the stomach. So you put the stomach up to connect with this other part that has no cancer, and then God is very graceful, because normally the stomach adopts and becomes an esophagus, and then down here it develops to become a stomach. So usually this is very curative. It's not an easy surgery. But then if one presents very late, if the patient presents very late, then usually what is done is palliative and supportive management. Remember, this person now has not been able to swallow food. So what is done is a tube that is inserted directly to the stomach to try and make him to try and feed him, or a stent. A stent is inserting a spring that opens up the obstructed area, and then so that he is able to swallow. So again, this person now who goes through this and not able to swallow may not be able to undergo surgery. So now what would be done is what we call radiation. So radiation is done to expose these cancer cells onto high or strong radiations that usually damage the cells, and to try to kill them and stop them from growing. Prognosis is the likelihood of achieving good results. It's not usually very good if someone presents at a very late stage. So it's very advisable that please we get checked and seen frequently, so that in case these things occur, we present on time. It's usually, you can see how the surgery is done. So it's usually better if the surgery is, if the growth is on the lower side than if it is very high, because now very high, you have the heart around there, you have the lungs, you have the trachea. So when it is very low, then it's easier to access the cancer down there and cut it off, So that is esophageal cancer in short, and I hope you have an understanding of what it is, how it affects you, and you've seen that it is not easy to manage if we do not seek care on time. So it's my humble request, and it's a knowledge awareness here, that please get to know what it is, and that it's not an easy condition to deal with, so that you get checked frequently. And in case you have any symptoms that you'll be worried about, that see a doctor and be informed. So next video, I'll be looking at cervical cancer, very prevalent cancer as well, that we see very, very commonly. Thank you.